And your vision in starting CFHI was do you want to just talk a little bit about that? And I think Avril can kind of chime in from her experience.
Yeah, I don't know if you've ever heard this story or not, Avril, but I wanted to learn Spanish, and so I went to the School of Medicine at Stanford, which did not have a Spanish language class for medical students, and was able to take an evening class that was off campus and realized that what I really wanted to do was be able to care for the underserved communities in the Bay Area that speak Spanish. And so I took about a month and a half of Spanish, and then was able to find my way down to Ecuador, where I had a colleague and a contact. And I was able to learn some Spanish, but also to spend some time in some of the clinics. My colleague was a medical professional, and so I was invited into that community. It took a lot to do that. It was back in the 1980s, and it wasn't easy, and the university wasn't really open to that kind of experience as accredited experience in clinical work. Things have changed a lot since then. But what my vision was then is that this should be an easier experience for students, that our world is a classroom and that we really need to be studying health in a global perspective. Now fast forward 20 years and it's very different. We have many universities that have these centers for global health, and we have been one of the longest standing organizations that sends students abroad.
So having seen students now since 2003 coming through your program in Cape Town, are you seeing any difference as we get to 2010?
I would say there's a huge difference. Okay. Firstly, when I started off in 2004, you must remember, for me it was a challenging process, you know, having to stand in front of medical students, especially, and giving them a talk or lecture on our healthcare system or different healthcare conditions. And when I initially started, you had a student that came in with these high expectations and, you know, I want, and it's all about I, me, myself. And the structures that we've implemented into the program has sort of changed people's mindset and their perception about mostly Africa and our program and what our goals and objectives are. So students have changed. They have learned to read up on things, because in the past when you would give them certain materials and prepare them better for their trip, they would get there and ask you the same questions and, oh, did you read the material we gave you? No, we did not. So a lot of, and I think CFHI must take the credit for that, because they, in a way, they have certainly prepared our students much better, because there is definitely a change in the students' attitude towards the whole program.
Well, and I so much appreciate your feedback. I mean, even while you're here in San Francisco, we're having meetings about how can we prepare students even better. So it's a constant process for us of how best to prepare them.